In this segment of Committee Connect, we sit down with Committee Chair Representative Steve Gottwalt and Committee Lead Representative Tina Liebling to look at the issues before the House Health and Human Services Reform Committee. Thank you, Representative Gottwalt, for joining us and taking part in this interview.
My pleasure.
Now, as Chair of the Health and Human Services Reform Committee, what is your role like?
What is my role like? Wow. Well, it's a very busy time, obviously, for healthcare reform, both with what's been going on at the federal level as well as what's happening here in Minnesota. So my job really, and part of the reason we renamed this committee from policy to reform, is that in the crisis we face, both financially and otherwise, is an opportunity to do things differently. The old definition of insanity is expecting different results from doing the same thing over and over again. And so we see the opportunity to actually reform how we're delivering care. The kind of three-legged stool of healthcare reform is cost, quality, and access. And we want to try to address all of those with some new ideas, doing things differently. And particularly in the area of state public programs, because those are the programs we have control of, obviously, because they are state programs. So we're trying to find some different ways of doing those things. It is Health and Human Services, so it covers a variety of state programs, particularly for special needs populations and low-income Minnesotans. How can we do a better job of meeting the needs of the Minnesotans who really need our help? So focusing on strong safety nets, but not catch-alls. And then how can we deliver that care, those services, that support in a cost-effective way that results in better outcomes?
Representative Liebling, turning to you now, what is your role like as lead?
Well, I'm very pleased to have that leadership role this year. It's the first time that I've been in this role because the lead, or the committee chair in the last session was Representative Thiessen, who's now our minority leader. So I am probably the only one in our caucus who's in a leadership role who wasn't in that role before. And so I'm a little bit finding my way, but I think my main role as the lead is to be a conduit between that committee and our larger caucus to help our members understand what's going on there, to sort of organize the minority members so that those who don't have as much background in the area can learn and help bring their concerns forward and kind of be a liaison with the chair as well.
What is your working relationship like with the chair, Representative Gottwalt, and with some of the other members in the committee?
Well, we've gotten along quite well so far. It's been he's been a very amicable chair. I think he's run the committee in a very respectful way.
And Representative Gottwalt, would you like to comment on your working relationship with Representative Liebling?
Representative Liebling, we've known each other for all my time here in the state legislature, and our job obviously is, we're going to differ on some issues, but I think both of us have a sincere desire to serve the people of Minnesota, to do the best we can by them in a very difficult time.
What are some of the major issues that you would like to see the Health and Human Services Reform Committee address?
Minnesota has to take control of its own healthcare destiny. We do things better than almost any other state in the nation. We have better outcomes, lower costs, better access to care, one of the lowest rates of people who are not covered for health care, one of the highest rates of people who have access to coverage. So we want to preserve that lead. We want to do everything we can to move that forward and not go backwards. There are still a lot of unanswered questions about how the ACA will play out in the states, what we'll be allowed to do, what we won't be allowed to do, what will be required to do. And again, some concerns about constitutionality. Does the federal government even have the right to tell us as individuals or a state to do certain things? And all of those are important, and we're trying to kind of look at all of those aspects and figure out what helps Minnesota preserve its lead and move us forward.
You know, we are starting to have a lot of discussion about the Affordable Care Act, implementing health reform, which we've been really ahead of the curve here in Minnesota. We've done a lot of work so far that's put us in a relatively good position, but it's really important for us to continue that and to work with the federal government to make sure that Minnesotans really get the best possible results out of the Affordable Care Act. And people have different ideas about that. So that is something that I feel very strongly about, though, that we cover people, that we restrain the cost of care without harming people's care, and making sure that Minnesotans are as healthy as they can be.
And what is your hope going forward in the legislative session?
Well, there is some very important work to be done implementing the Affordable Care Act. One of the concerns that I have is that there are sometimes people, some people have sort of what I would consider an anti-science bent. And science has been very important to Minnesota. It's very important in my district because my district is the home of the Mayo Clinic, where incredible innovation happens. And it's really important that people outside Minnesota don't begin to think that Minnesota is anti-science and anti-research and anti-technology. Because really that's one of our big leading things in terms of our economy. And that's nowhere more true than at the Mayo Clinic. And we attract people to the state, we attract smart people, we attract innovative businesses, because we are a high education, high science state. And it's important to protect that and not let people's concerns and fears drag us off of that, where people start to believe that Minnesota is not welcome, that Minnesota does not welcome science.
At the end of this legislative session, what do you hope the committee will have accomplished?
I'm hoping that we can arrive at some bipartisan ideas that really represent true reform. Reform in how we deliver care, reform in how we connect patients to their own health, reform in systems of care. How do we create kind of an integrated system of taking care of people that keeps some skin in the game for the patients and also incents providers to deliver the right care in the right amount at the right time. Frankly, I think if we can hold special needs populations, low-income people, harmless, try to do as little damage as possible to the safety nets in the state, and then also flatten the curve in the increased healthcare costs in the state, I think we will have done a lot to set ourselves up for success in the future. And I think that's very important. We have an opportunity right now to reset and do things differently so that we can sustain the promises we're keeping. I've said it many times. We've been making promises we can't keep with money we don't have, and that's what we need to change. We need to make promises we can keep with resources and revenue we do have.
Thank you, Representative Gottwalt, for joining us here today. We appreciate it. Representative Liebling, thanks for making the time for us.
Thanks.
Thank you. Committee Connect will continue to feature different committees throughout the legislative session, giving you an insider's look at the important work being done in the House of Representatives. Also, you can learn more about the actions of the House Health and Human Services Reform Committee and other House committees in the free, nonpartisan magazine, Session Weekly, and in the online news service, Session Daily. You can also watch live coverage of different committees on House TV.